Welcome to this episode of Occasional Conversations. As usual, my name is Brenda. I'm excited to be here. So May was maternal mental health month, and in that beautiful spirit, I I figured it's such a good conversation to have. And considering the number of babies, you know, every day, the rate is quite high. Um, it's such a beautiful conversation to have. So we're going to talk about maternal depression. Maternal depression, we have the incredible Evelyn Betubiza. Thank you for always coming. Always.
Welcome. Thank you for having me.
Yeah? Yeah. So Evelyn and I are going to have an in-depth conversation about maternal depression. What's maternal depression? Maternal depression is a set of conditions that affect mothers from pregnancy to about 1 year postpartum, right, Evelyn?
Yeah.
Yes. So it encompasses things like prenatal depression, postpartum depression, the blues, the baby blues, postpartum psychosis. I feel like so many women during pregnancy struggle with so much emotion but they don't know what they actually struggle with. They just know, I don't sleep, my appetite has changed, I'm sad, I hate myself. Well, all these symptoms fall under these, should we call them disorders?
The word disorder is huge.
I
Let's just
know.
call them distresses.
Distresses. Thank you, Evelyn. So yeah, Evelyn, you're going to take on the floor. Kindly guide us, teach us the different kinds of distresses that affect maternal, or let's say mothers, right from pregnancy to postpartum. It's your floor. Please introduce yourself the best way you want us to know you.
Uh, Thank you, Brenda.
You're welcome.
Friends, I'm sorry I'm wearing a mask. I have a cold and I'm being mindful of my friends here.
Thank you very much. Thank you. We appreciate it.
You're welcome. So, I'm Evelyn Betubiza. I'm a psychotherapist with Conquer,
Thank you.
Uganda.
Proudly associated.
Very delighted to be associated.
Yeah.
Uh, so, maternal mental health. Uh, Firstly, the reason why I don't encourage using the word disorder, we are encouraged as when we're studying and when as you practice, not to use certain words because unless the situation actually qualifies it. Now, if you have like schizophrenia, yes, that's a disorder. Bipolar, that's a disorder. But depression is a distress. When you say disorder, someone thinks, oh, this is so huge.
Oh, they freak out. I have
Ah,
a disorder. Okay.
um, uh,
Okay.
like it's a disability of
Yeah.
some sort.
Understandable with the stigma around mental health. Totally understandable.
Yes.
Mm.
So, maternal depression.
Mm.
Very glad you've listed it all down, and I'm going to share with you the way you know listed them down.
Okay.
There's
Okay. Yeah.
now you started with the postnatal.
Prenatal.
Pre, it's oh yes,
Yeah.
prenatal depression.
Yeah.
That's also called peripartum.
Okay. Okay.
So these are the changes that the mother goes through during the from the period of conception, up to birth.
Okay.
Yes,
All those changes.
yes. The first of all, there's the physical changes. Your hormones are all over the place. You sweat a lot. You get, my cousin calls them whiplashes.
Whiplashes. Okay. Sounds good.
I tell her, oh, you're too fancy.
Right? Yeah.
You know, you can, these things where you climb the stairs and you're out of breath and you're sweating. The sweat is literally dripping down and all those things. And then your appetite changes, and then your body is changing. You're putting on weight.
Yeah.
So all those things, people think that a woman is supposed to feel okay about this.
Yes, people normalize these emotions, right?
Yeah, and it is not okay. I mean, I'm used to having this body.
Mm-hmm.
I'm
Then
excited,
now?
yeah, I'm excited that a human being is growing inside me, yes?
Yes.
But understand, I'm going through changes that I am not excited about.
Yes.
And they don't come smiley and happy. You know, they just hit you. And I think the worst time the clients I've met, I think the worst time is towards birth. Because you can't sleep on your back, you can't sleep on, you have to sit, it will sleep on your side, all those discomforts.
Such an inconvenience
Yes.
after you've been used to not having any of these.
Exactly.
Yeah.
So one thing I want to emphasize to people out there is that, friends, these are not just feelings, they're not just emotions. These things are real. These are things that someone is literally living through.
Yeah.
You know, there's also this fear. People don't understand that you have to wait. When you go through the first trimester, you breathe, oh yes, the baby's okay. Second trimester,
Yeah.
oh yes, the baby's okay. Third,
The anxiety, I can
yes,
see it. Yeah, right?
that-
Will I be fine?
exactly, the anxious feelings that.
Yeah.
So I encourage people, when your partner, you know, I encourage the fathers, the husbands, when your partner is with child, don't only be there to buy the ice creams and all those things.
Thank you very much. Just to be there.
I know. Be there to actually listen to her. If she's getting moody, don't say, she's acting up. You know, women.
Yeah.
No, be kind. Ask her, what's the problem? And stop thinking that these are bazungu problems. I don't know what's wrong with Africa. Who tells you depression knows race? When depression is coming, it doesn't know this is white, this is black.
I feel like at this rate, even because of our systems, our health systems, our education system, I feel like it actually affects us more. Especially, look at our country and everything that's happening. I think we are very prone to depression.
Exactly. And the current systems right now,
Yeah.
2021,
Ooh.
like there's a lot going
And the
on.
pandemic.
I know. People are not doing that all right. Even the ones you think are doing all right, and they're not. Everyone, people are having different distresses,
Yeah.
and you want this person to actually birth this child. You know, anxiety is one of the reasons at the top that cause miscarriages.
Yeah.
Because you're in this thing, and your partner is not with you. They're just saying she's being emotional, she's being blah blah blah.
Yeah.
Partners, husbands, boyfriends, fiancés, whoever you are to that woman, be there.
Be understanding. I mean, you could only imagine as a man, your changes are probably work, body. I feel like even men get stressed about body changes. So imagine what you feel now, amplify it by, I don't know, a millionth time. Is the kind of distress mother. I can imagine that's the kind of feeling they have. So be understanding to your partner. Understand that there's changes going on and walk through the changes. But let's not divert so much, Evelyn. I want us to go into the detail for the different distresses.
So now that's this peripartum
Yeah.
is some women
Mm.
like, first of all, I want you to know that not everyone will suffer from this depression. Yes. If you have a history of depression,
Yeah.
you're most likely to suffer from it.
Okay.
If you don't have a support system,
Mm.
for instance, you weren't planning this baby, just landed,
Mm.
yeah, and you don't have that support system, it will probably trigger that. But in most cases, when you seek help, when
Yeah.
you have a support system, it doesn't last long. It's normally between the first 3 to 4 months, because that's when your body's, all over the place. You
Yeah.
have nausea. It's just getting with the program.
Yeah.
After that, your body tends to stabilize.
Mm.
And
I like what you said. It's getting with the program. It's aligning with the program. Yes. Yeah.
And I encourage you, when you start feeling depressed, when you start feeling low, and like we discussed earlier on, like you shared about depression in the earlier
yes.
segment.
Yeah.
We know that depression is that constant feeling you have, that same feeling for about 2 weeks. You're
Yeah.
not
A
getting-
constant
yes,
feeling
yes,
of
of lowness.
yes.
It's not going away.
Mm.
So when you have those symptoms and you do not have a support system around you, kindly get in touch with your health worker, yes?
Yes.
Because you can't remember this child, you have a child, you can't go and start self-medicating. Like there are certain medications you don't take when you're with child. And there
Yeah.
are those ones that are safe for you when you're with child, and still it depends on the severity. So in short,
Are these medications you're talking about in regard to the depression?
yes,
The maternal depression?
yes,
Okay.
like for the depression.
Yeah.
Uh, so basically, that's about prenatal depression.
Yeah.
It's not as rare as we think, and it's not as common as we think. But
Mm.
when you feel it, like we discussed earlier on, we know what depression is. You know, when you have those feelings, seek go to your medical worker.
Yes. Okay.
They will prescribe you the right medicines, and most times it's just even you having a chat with a psychotherapist, and you don't need the meds.
Yeah.
Because when you're with child, we try to limit the number of meds you're pumping into your body because your child takes it too.
Okay. So let me just highlight this again because I feel like there's so many women at different stages, and these distresses, like Evelyn called them, come at some point, manifest at some point, and some go at a certain point. For example, prenatal depression, like she said, comes onsets during pregnancy. So you'll find so many people struggling with sleep. People will tell you have insomnia, weepiness. Someone is just crying for nothing. Someone is just, I'm not wailing. Oh, I hit my leg. Oh, I didn't get the call. So all that hormonal burden. So people, for prenatal, I feel like because of the hormonal changes, it's okay to be hormonal, right?
Yeah,
You won't be the same as before.
Yeah.
But watch out for the magnitude of these symptoms.
The changes,
Yes, that changes. Anything that's constantly depressing. Like I said, the symptoms to the prenatal. And after prenatal, we have the baby blues. Many people just say, oh, she has baby blues, and they think it's just being scared of giving birth. No, people, baby blues, these affect actually about 80%. Did you know that? I didn't know. I just found out. That's a big number. So basically, most mothers who give birth actually struggle with baby blues. How do baby blues manifest, people? How do you feel when you have baby blues? The baby blues symptoms are almost similar to the prenatal. The weepiness, most of it is weepiness and sadness beyond normal. So mothers, if you feel something small has happened to you, but the effect is so grand,
Yes.
please don't listen to this. Oh, she's just a first-time mother, so it's okay. She feels that way. No, people, no. There's no such thing as it's normal. It's common because, like I said, it affects 80% of people. But pay attention to it. Get help. At Conquer Uganda, let me pause on the other distresses. We're going to continue. But how do you get help about this? You're seeing your gynecologist, obstetrician.
I know that sounds familiar.
Yes, so you can start there. Talk to them. Because sometimes it's not just a depression, it's probably other issues. So talk to your health contact, the person you've been going through this whole journey with. And after that, when they ascertain that it's actually depression, I am a co-founder and MD Conquer Uganda. What do? We have Evelyn and so many other mental health practitioners and specialists working with us. So we are dedicated to this cause. So reach us. I'm going to put the numbers. Our website is running. Our numbers are constantly on 24/7. So reach us, as a practitioner is going to guide you and you'll be fine. And guess the good news. It's actually curable. People get fine.
Yeah.
Just reach out for the help. Very curable, so don't be scared. So on the distresses, I'm sorry I'm taking on your role, but let me,
Yeah.
So we have the postpartum depression. What's postpartum? Postpartum onsets after delivery and lasts maybe, I think, a couple of months.
It can even go up to a year.
A year.
Yeah, because like you said, it's after birth.
Yes.
Yes, and first of all, there are symptoms. Yes?
Yeah.
There's signs and
Yes.
symptoms.
Yes. Would love to know.
Remember, there's a baby in the house. You're not sleeping enough. You're obviously tired. You're obviously overwhelmed. You
Yeah.
know? And postpartum depression, some people, some mothers get, when you get this feeling, your child is crying, I don't even want to hold them.
Oh yes.
That doesn't make you evil.
That doesn't make you a bad mom.
No.
Yeah.
It means you're struggling. That
Yeah.
is the biggest sign, the hugest sign of postpartum depression.
Okay.
Because naturally, when you birth, you're supposed to bond.
Yes.
That bond that just clicks.
Yes.
You know, I've not birthed before, but my nephews were birthed. Like the first, my first nephew was birthed, and I bonded with him outside the maternal ward.
Yeah.
So I can imagine the bond the mom had.
Ooh, yeah,
Yes.
yeah.
So by default, women, we are nurturing, we care, we love. So when that happens, that is a huge red sign. It doesn't mean you're weak. It doesn't mean you're bad. It just means that you're overwhelmed.
Okay.
And you should seek immediate therapy.
Immediate.
Immediate.
Okay, guys, did you hear that? Mothers, when you feel the bond, you're struggling with a bonding situation with your baby, like she said, it's absolutely not your fault. It's really not your fault. There's nothing wrong with you. You're just not okay. And that's very normal. Like, you cannot go through a new journey, especially like for first time mothers. You have to go through changes. You don't understand them. Most of them are painful, most are annoying. Probably some of them are regrets, you know.
So true, yeah.
So don't beat yourself up. Just know that these distresses actually happen to majority of mothers, but get immediate help.
And one thing, these things don't only affect new mothers, you know, because every child is different.
Okay.
You know, every birth is different, every conception is different.
Okay.
Just like every child is different. So you could have like six, and and they were what we call smooth, and then the seventh one comes
Oh.
and they are
The troubled little child.
and you start blaming yourself, and you start saying, how do they see me, a mother of six, in a line to see a therapist because I'm failing to bond with my child?
People, let's lose that mindset. It's a
True,
terrible
true,
mindset.
true. Every child is different, every conception is different, every birth is different. So when you feel you're not bonding, when you can't, when you fail, sometimes it is even you fail to breastfeed, generally, all those distresses, all those signs, they are pointing to depression. Kindly seek help.
Help.
And as Brenda has said, Conquer, we are online. You can just
Yeah.
type in, and you will get us, and we will help.
And we are
you.
proudly willing and waiting for you to come through. It makes us happy. It's our satisfaction to help you. And knowledge is power. You really can't fight something that you don't know what you're fighting, right?
That's true.
So I hope you know that all those inconveniences, those setbacks you're having is actually part of maternal depression. There's one particular one I want us to mention, the psychosis.
Now, the psychosis is a graduation from the postpartum depression.
Okay.
One thing I want to, the two are different, because with psychosis, there's also hallucinations, and
Yes.
delusions.
Yes.
Now, in the depression, those are not there.
Yeah.
But when you start getting delusions and hallucinations, like, oh, someone is telling you kill, a voice is telling you kill that baby. You
Yeah.
know? When you hear voices, or you see people telling you to harm your baby,
Yeah.
your child,
Yeah.
or yourself. Now, that is the epitome.
Yeah.
That's why it's called psychosis.
Psychosis.
Now, psychosis, when you read psychosis, now I can call that a disorder,
Yes. Oh, I get you now. Yes.
because it is it plays with your psyche. You're no longer in tune with the real with the real life.
Yeah.
You're imagining
Your
things.
brain is playing games
Yes.
and they look like the reality.
Yes, and to you it is real.
Yeah.
So first of all, I've shared the two main things: delusions and hallucinations.
Yes.
Now, psychosis is treated with both medication and psychotherapy.
Okay.
The postpartum can be treated with psychotherapy only.
Only. Okay.
But if it is caught early, yes. But the psychosis is treated with both the medication and psychotherapy.
Psychotherapy.
Yeah. So, first of all, I want you to know that hearing those voices doesn't mean you're insane. Doesn't mean you're insane.
You're not insane.
You're not cuckoo. I don't like
Yeah.
using that word. It is not a kind word.
I think we should use it on this conversation because people use it. We might as well say it the way it is.
Yeah.
Right?
You're
People
not-
call
you're
you
not
crazy,
actually
but you're not crazy.
You're not crazy. You're not insane. It's just that your body has gone through depression, and you have probably ignored it or downplayed it.
Mm.
Now your mind is trying to cope up with it, because
Yeah.
at the moment the source of your pain and your distress is that child.
Yeah.
So the mind creates this illusion of, you get rid of this thing and you're going to be okay.
Okay.
And I just want us to know that very few people have actually acted on this. Some have,
Yeah.
and it's a very small percentage.
Sorry, that percentage, is it the people that we hear of or read in the papers or on the news, the mothers that throw their babies, the mothers that abandon their babies, and later on when they're traced back, they actually don't know what happened? Is that part of the psychosis? Is it a case of psychosis?
Some of them are, some are just, what can I say? Some of them are.
Some,
Yes,
not
some
all.
of them. Yeah, not all. You would have to sit in a session to assess this person.
Oh, okay.
Yes. But some of them are, some are not. Some people just, I got pregnant because I wanted to keep this man. He's not around. I don't need this baby.
Oh, okay. Anger.
Yes. Anger, disappointment. Yes. But some people actually loved and consider children in love, but they've just become unwell. They're just not fine. They're
Yeah.
not. They are overwhelmed. They're overly overwhelmed.
Understandable. It's a new chapter. You mentioned something. You said you can only find out it's psychosis after a session. So what you're trying to say is, even if the symptoms that you think you're experiencing, even if you read about it and they kind of point towards psychosis, you cannot know unless a therapist actually evaluates you and tells you you're suffering from psychosis.
Exactly. That's why you're not encouraged to self-medicate. Yes. When you're going through all that, you can't sleep, you can't eat, you're hating the baby, you're hearing voices that are telling you to harm your baby or to harm yourself and all those things. The best decision for you to make is to see a therapist. Then the therapist will decide, will share with you and will assess and tell you, okay, this is what you're dealing with, because even that psychosis is it's in levels. Yes.
Okay.
Sometimes by the time it is full blown, someone has actually gone what we call insane. Because psychotic, by the time someone calls it psychosis, it means like you're not okay. I don't know
Okay.
if you've seen. We've all seen crazy people on the road.
Crazy as people want to call
mentally
them.
unwell
Yeah.
on the roads.
Yeah.
But we don't call them psychotic unless they become violent.
Yes.
Now the emphasis, the psychosis comes with violence. You know.
Okay.
There's an aspect of you being violent either to you or towards someone else.
Okay.
And then there are also psychotics who are calmish.
Okay. Okay.
Yeah.
Let me just deviate a little from our conversation. So are those like the psychos like in the movies? What, you know, like how someone's a serial killer and is very calm and they call them psycho? Is that what you're talking about? Just a small deviation, we're going to go back.
Yeah.
That's it, yeah? So people,
Yeah.
those are quiet psychos.
Yeah.
Anyway, yeah, back to
But
Yeah.
now, which people are more susceptible to this? Yes?
yeah.
Now, not everyone who suffers from maternal depression will suffer from this postpartum psychosis.
Yes.
But if you know, we all know ourselves, yes? You know, if you have a history of suicidal tendencies, you've battled depression before,
Yeah.
yes, kindly, when you start feeling unattached to your, detached to your child, kindly seek for help. Because this is the thing, depression is curable, yes? But every single one of us deals with depression
Separately or differently?
no, yes. Every we all know our triggers. You know, if you've dealt, it's like stress. You know what stresses you, Brenda. Right?
Yes.
And when you get in that zone, you know how to run out of it. To get yourself out of it.
Yes.
Exactly. So everyone out there who has struggled with depression, you know what triggers you. You know your trigger.
Oh, I get it.
So when you get into that rant, yes, you know what not to do. You know which people not to be around. Personally, when I'm having those blues, yes, now I know which people to stay away from. I know where not to be, and I know where to be, and I know who to be with.
But guess what, Evelyn? I feel like it's just a small percentage of people that struggle with like different kinds of depression that actually know their triggers or how to deal with them, right? That's what I think. I don't think everyone knows how to deal with their triggers.
This is why when you are dealing with depression or stress, that's why you're supposed to seek mental health, not go and buy sleeping pills from a pharmacy across the
right? Or drink alcohol, people.
I know.
Yeah.
That's why talk to a mental health specialist. And guys, we're not as pricey as we should be.
Oh no, we are really actually cheap, people. Our service is quite affordable. It's just 50,000 Uganda shillings, people, for the first session. And because of how amazing our therapists are, how professional they are, the price goes a little higher. But for the start, come through, see someone. 50,000 is a good fee, to be honest. Come through, talk to someone. And like Evelyn has said, it's important to know your triggers, because I can't imagine that you're struggling with depression, but you can't even identify your trigger and you don't know how to deal with that. That's such a lonely road. I suggest that even before seeing the therapist, educate yourself on this subject matter. So many of us don't want to read, listen to podcasts. Look at us having a conversation. You don't want to listen to us? How are you going to know these things? So educate yourself to know how to handle what you're struggling with before the specialists come in to clear the issue.
That's true.
So Evelyn, you said depression is actually curable. That's good news.
It is curable. It's not a cancer, you know. It's not written in your DNA.
That I was made like this, a depression. No.
It's like Brenda has said, you know, study. Learn. Personally, I was told that there's a history of mental health distresses in my family, starting from my grandmother.
Okay.
So I went through a phase. So they had to go down my genealogy and all those things. It's actually true. Yeah. It could be some disorders are genetic, like schizophrenia. Bipolar, but depression, truthfully, it's your lifestyle.
Yeah.
It doesn't matter if your mother is battled depression for 20 years. If your lifestyle is not healthy is not kind to you, you will battle it even when you didn't have to.
True. The social aspect of life and the environmental aspect. So whatever you expose yourself to,
exactly,
is going to either accelerate or just bring it if you didn't have it. So guys, let's pay attention to our environment, who we interact with. Let's read and study on these things, because 80% of mothers struggling with a distress is not a small number. That's basically almost every mother that's giving birth is struggling with these unknown emotions. But yeah, people, we are here We're going to share our numbers. Our website runs 24/7. It's active. Our therapists, I can vouch for them. Well educated, very professional. So please, best believe you're going to get the best service. Evelyn, as we wind up, first of all, thank you for having this conversation. I hope we continue having more of these. Is there any take home that you feel like, because you've not hinted on and you feel like these mothers need to hear? Maybe a way forward, a
Um,
lifestyle change.
One thing, I like the fathers out there, they also suffer from
Oh,
postpartum depression.
this I did not know,
They actually
genuinely.
do, the men do too, because, you know, you're wailing and screaming, the
Yeah.
baby's also there and they're also there. And we tend to concentrate more on the women and
Yes.
ignore the men.
Oh,
Yes,
okay.
the men really don't carry the baby for 9 months, or their bodies don't really go through any changes.
Mm.
But
And they get the 5 days paternity leave to
I
rest it
know.
out. And they don't change diapers. Most of them just sleep through the noise at night. But okay, yeah.
fathers start changing diapers.
Yeah.
Okay?
But we care about the
Yes.
father's postpartum depression. I actually didn't know about this. So, gentlemen, please know that you can actually struggle with this. Reach us, reach a therapist. If you don't want to reach us for whatever reason, reach another therapist and get help, people. It's curable. Life can be better. You can live a better standard, maybe, of life. And listen, even if you have it, please know that you can actually function in life with this depression.
That's true.
Yeah, you can actually function until you're fine. Yeah?
Mhm.
Guys, I hope you enjoyed this conversation. We're going to have a lot more of these. I'm open to any suggestions, any critique. Kindly tell me anything that's on your mind. Don't forget to subscribe, like, and press the bell, the notification bell. Yeah. Until then, thank you, Evelyn. Bye, guys. We'll be bringing more conversations. Cheers.